Welcome back to Capsa. In today's video, we are diving deep into meningitis, a condition that is not only life-threatening but also demands quick action and comprehensive understanding. Whether you are a medical student, a healthcare professional, or someone keen on understanding health topics, this video is for you. We will talk about what meningitis is, its type, causes, early signs, diagnosis, treatment, and even dietary requirements during recovery, and FAQs. This is going to be a detailed session, so grab your notebook and stay till the end. Let's get started. So, what exactly is meningitis? To understand this, let's first get familiar with the meninges. The meninges are three protective layers: the dura mater, arachnoid matter, and pia mater, that covers the brain and spinal cord. Meningitis occurs when these layers become inflamed due to various causes, including infections by bacteria, viruses, fungi, or even non-infectious conditions like autoimmune diseases. This inflammation can lead to severe complications such as increased intracranial pressure, brain damage, and in some cases, death. Let me emphasize that meningitis is a medical emergency and timely recognition and treatment can save the lives. Meningitis can be classified based on its cause. Each type has its own implications and treatment strategies. Let's break down it. Bacterial meningitis. This is the most severe form and requires immediate medical attention. It is caused by bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenzae. It progresses rapidly and can cause permanent neurological damage if untreated. Viral meningitis. This is more common but less severe compared to bacterial meningitis. Viruses like enteroviruses, herpes simplex virus, and mumps virus are common culprits. Although most cases resolve on their own, some require antivirals. Fungal meningitis, rare but serious. This type typically affects people with weakened immune system, such as those with HIVs or AIDS. Cryptococcus and Candida are common fungal pathogens. Parasitic meningitis, very rare but fatal in most cases. One example is meningitis caused by Naegleria fowleri, commonly known as brain-eating amoeba. Non-infectious meningitis, this includes meningitis caused by autoimmune diseases, cancer, or adverse drug reactions. It's not contagious but require treatment under the underlying cause. Now let's dive deeper into the pathophysiology of meningitis. How does it develop in the body? Understanding this will help you connect the dots between the symptoms and the disease process. When a pathogen like bacteria or virus enters the body, it can breach the protective blood-brain barrier, a system that usually prevents harmful substances from reaching the brain. This triggers a massive immune response. Cytokines, which are inflammatory mediators, are released and immune cells flood the area. This immune activity leads to swelling and inflammation of the meninges, causing the classic symptoms of meningitis like headache, fever, and neck stiffness. For bacterial meningitis specifically, the bacteria can also release toxins that directly damage brain tissue, compounding the tissue. This is why early intervention is crucial. Recognizing the early symptoms of meningitis can be life-saving. Symptoms may vary depending on the type, but let me walk you through the most common presentations. In bacterial meningitis, the classic triad of symptoms includes fever, neck stiffness, and altered mental status. These are often accompanied by severe headache, nausea, and vomiting. In infants, the symptoms can be more subtle. Look for irritability, poor feeding, and a bulging frontal. Rash, particularly in meningococcal meningitis, is a late but critical sign. This rash does not blanch when pressed. Diagnosing meningitis accurately and quickly is critical because the condition can progress rapidly, especially in bacterial cases. Doctors rely on a combination of clinical evaluations, laboratory tests, and imaging studies to confirm the diagnosis. Let's go through this step by step. First, the clinical examination provides important clues. Doctors look for hallmark signs like fever, neck stiffness, and altered mental status. They may also test for specific physical signs such as Karnick's and Brudzinski's signs, which indicate irritation of the meninges. Next is the lumbar puncture, also known as spinal tap. This is the gold standard for diagnosing meningitis. It involves extracting cerebrospinal fluid or CSF from the lower spine. This fluid is then analyzed for the key parameters. Let's discuss the findings in bacterial meningitis specifically. The appearance of the CSF is usually cloudy or turbid. White blood cell count is significantly elevated with the predominance of neutrophils indicating bacterial infection. Protein levels in the CSF are higher because of inflammation. Glucose levels are low since the bacteria consume glucose. Finally, ground staining and CSF culture can identify the exact bacteria responsible, helping guide treatment. Imaging studies such as CT scan or MRI may also be ordered, especially if there are concerns about intracranial pressure. These imaging help rule out complications like abscesses or mass lesions. Treating meningitis depends on its causes, but bacterial meningitis requires urgent and aggressive management. Treatment involves hospitalization and often starts even before diagnostic results are confirmed, especially if bacterial meningitis is suspected. First and foremost, empirical antibiotics are initiated based on the most likely pathogens for the patient's age and risk factors. Once the positive bacteria are identified through CSF culture, the antibiotics can be adjusted accordingly. For example, in adults, the typical empirical therapy includes ceftriaxone and cefotaxime, and often combined with vancomycin to cover the resistant strains of Streptococcus pneumoniae. In neonates, ampicillin is added to cover Listeria monocytogenes. In addition to antibiotics, corticosteroids like dexamethasone are sometimes given to reduce inflammation and prevent complications such as hearing loss, especially in cases caused by Haemophilus influenza type B. Supportive care is equally important. This includes managing fever, maintaining hydration, and addressing complications like seizures or increased intracranial pressure. For viral meningitis, treatment is usually supportive, but in severe cases caused by viruses like herpes simplex, antivirals like acyclovir are administered. Fungal meningitis requires antifungal medications such as amphotericin B and flucytosine, often for longer period of time. Now let's talk about nutrition, an often overlooked but vital aspect of recovery from meningitis. While medical treatment addresses the infection and its complications, proper nutrition supports the immune system, speeds up the recovery, and prevents malnutrition. So, what should patient focus on? First, prioritize a nutrient dense diet rich in vitamins and minerals. Foods high in vitamin C, such as citrus fruits, bell peppers, and strawberries, help boost immunity. Vitamin A rich foods like carrots and spinach are also essential for repairing tissues. Next, include protein rich foods like eggs, fish, and legumes. Protein is crucial for healing and rebuilding tissues damaged during the inflammation. Omega 3 fatty acids found in fatty fish like salmon and in walnuts and flax seeds can help reduce inflammation. Hydration is equally important. Ensure plenty of fluids, including water, herbal teas, and broths, to maintain electrolyte balance and prevent dehydration. Now let's talk about what to avoid. So steer clear of sugary, processed food as they can weaken the immune system and promote inflammation. Similarly, limit the alcohol and caffeine as they can dehydrate the body. Foods high in saturated fats like fried or junk food should also be avoided as they can exacerbate the inflammation. So to wrap up this video, let's address some of the most frequently asked questions about meningitis. These are questions that many of you might have, and they provide valuable insights into this condition. Is meningitis contagious? Yes. Certain types of meningitis, especially bacterial and viral, can be contagious. They spread through respiratory droplets, close contact, or saliva. Practicing good hygiene and vaccination can reduce the risk. Next, meningitis versus encephalitis. What's the difference? So, meningitis refers to inflammation of the meninges, while encephalitis is the inflammation of the brain itself. While they may have overlapping symptoms, encephalitis often causes more severe neurological deficits, such as seizures and confusion. What is lumbar puncture or for meningitis? A lumbar puncture or spinal tap is a diagnostic procedure where a sample of cerebrospinal fluid is taken from the lower back. It helps confirm meningitis and identify the causative organism guiding treatment. How dangerous is bacterial meningitis? So, bacterial meningitis is a medical emergency with a high mortality rate if untreated. Even with treatment, it can lead to complications like brain damage, hearing loss, and even seizures. So, early diagnosis and prompt antibiotics are crucial. How does meningitis lead to death? So, meningitis can cause death by increasing intracranial pressure, leading to brain herniation, septic shock, or widespread inflammation that damages vital organs. Meningitis in newborns. What to watch for? In newborns, symptoms can be subtle. Look for irritability, poor feeding, lethargy, a bulging fontanelle, or high-pitched crying. Early medical interventions can be vital. Meningitis in college students. Why is it common? So, college students are higher risk due to close living quarters in dormitories and shared spaces. Neisseria meningitis is a common cause and vaccination is highly recommended for this group. Is viral meningitis less serious than bacterial? Generally, yes. Viral meningitis is often self-limiting and less severe, while bacterial meningitis requires urgent medical interventions due to its potentially life-threatening nature. Can meningitis be hereditary? Meningitis itself is not hereditary, but genetic factors may predispose someone to infections or immune deficiencies and increasing the risk. What happens if meningitis is untreated? So, untreated meningitis can lead to severe complications such as permanent brain damage, hearing loss, hydrocephalus, or death. Early intervention is crucial. How does meningitis affect the brain? Meningitis can cause swelling, increased pressure, and inflammation leading to brain damage, seizures, or cognitive impairment if not treated properly. Thank you so much for watching. I hope this FAQ section answered your questions and clarified any doubts. Don't forget to like, share, and subscribe for more in-depth videos like this. See you in the next time. Take care.